Autism Awareness in the Classroom by Donny Korpi, a student at Touro College. About autism. Autism is a disorder of neural development characterized by impaired social interaction and communication, and by restricted and repetitive behavior. The diagnostic criteria require that symptoms become apparent before a child is 3 years old. Autism affects information processing in the brain by altering how nerve cells and their synapses connect and organize. How this occurs is not well understood. It is one of the 3 recognized disorders in the autism spectrum, the other 2 being Asperger's syndrome, which lacks delays in cognitive development and language, and pervasive development disorder, not otherwise specified, which is diagnosed when the full set of criteria for autism or Asperger's syndrome are not met. Cases of autism. While we don't know exactly what causes autism, there are several factors and theories as to what causes autism. The first idea is genetics. Some say that one of the leading factors of autism has to do with your genetic history. The second major factor is prenatal environment. There are theories that there are infectious processes, environmental agents, and other maternal conditions that can affect the likelihood of autism. In addition, there are other theories about postnatal environment, and that include mercury and vaccines and other things that young children can be exposed to that could possibly cause autism. Living with autism today. Autism has grown leaps and bounds. 1 in every 110 children are affected by autism today. 1.5 million are affected by autism just in the US alone. Across the globe, tens of millions are affected by autism. Autism is a growing cause, which each year sees a 10 to 17% increase of autism diagnosis. Autism is much more common in boys than it is to girls, where there's a 4-to-1 ratio between the rate of boys and girls with autism. In boys, it's as common as every 1 in 70 boys. Diagnosing autism. While there are no medical tests for autism, diagnosis is based on behavioral observations. There are several signs to autism included in the picture on the right, and there are several different ways to check if a young child has autism, including early intervention. There's a modified checklist of autism in toddlers, and there's a criteria of autism diagnosis. What exactly does autism do? How does autism affect children? Autism affects children's abilities and can lead to such things like affecting their social interaction. Usually, children with autism find it very difficult to socially interact with other children, and it affects their ability to use language in social communications. Usually, students with autism are much more formal than other students. It also affects their symbolic or imaginative play, it can physically impair them, and it can give them academic difficulties where they can struggle in certain areas. While usually children with autism can actually be very bright and in certain areas can be very good. Autism has several social impairments for children as well. Children with autism are not responsive to verbal cues. They display extreme distress for no apparent reason. Speech and language absence or delays are present. They can have inappropriate language and giggling. They can have abnormal ways of relating to people, objects, and events. They can struggle interacting. They typically avoid eye contact. They can be slower learning to interpretations and others' thinkings and feelings. And some children remain nonverbal through very late into their lives. Others can become disruptive and physically aggressive. Some can have difficulty in sustaining a conversation, and some have inabilities to understand body language. In addition, there are physical and behavioral impairments that are caused by autism as well. Those include avoiding eye contact, seeming as if the child is deaf, developing language issues, lacking sensitivity to burns and bruises and pain overall, which can unfortunately lead to engaging in self-mutilation, having abnormal responses to senses, having uneven gross and fine motor skills. You can have seizures, tantrums, partake in aggressive behavior, be highly attuned or even painfully sensitive to certain sounds, textures, tastes, and smells, and have difficulty regulating their emotions, and they can be disruptive and physically aggressive. Autism can also affect students academically. Many times, children with autism are thought to be mentally retarded. They tend to have a lower IQ. Like I mentioned before, they can have language issues, can be unable to communicate understandings. Communication and language issues may not allow students to acquire new information. They can be easily distracted in the environment, and they can have sensatory issues, which means they cannot learn through their senses. There are several teaching strategies to help those with autism. One of the most important things a teacher can do is create a less stimulating environment. The less distractions students with autism have, the better. Additionally, make sure that that environment is based on predictable events. That it's very good to get a child with autism into a routine and not confuse them. In addition with that, some other good steps include giving them fewer choices, using repetitive motions to help them understand it. It's important to keep your voice low and clear, to limit physical activity, allow the students to stand, promote social skills, eliminate stress factors, and it's always important to use signs and pictures. When dealing with students with autism, it's important to have a good classroom setting. Freeing up any distractions such as noises and objects in the classroom can help keep a student with autism focused. It's also important to keep everything in the classroom organized. This helps create a less stimulating environment. It's also important that you remain consistent in your teaching across different settings. And there are also several pieces of technology that are designed to help students with autism. There are several educational approaches to help students with autism. Many times, students with autism get a task sheet for them to check off. And while it may be something so simple to us, to them it would help even just having a check-off list. Some other approaches are to use explicit instruction and concrete examples, plans for generalization, predictable routines and schedules, behavioral approaches to address problem behaviors, carefully explain expectations, foster positive learning experiences, provide structure, arrange tasks so that the students can perform them, have successful use of time, specifically going from one task to the next, and breaking up tasks into smaller parts. Like the picture shows on the right, we may consider brushing our teeth one task, but to a child with autism, it's actually 5. There are also behavioral approaches to working with children with autism. Remember to tell individuals with autism when the behavior is proper. It's important to clearly identify the inappropriate behaviors and to carefully analyze the behavior. Use behavior charts like the one on the right or a reward system to give positive reinforcement. Determine the positive replacement behaviors to teach when negative behaviors are occurring. And it's important to teach children with autism how to stay calm. Communication is one of the most important things when teaching children with autism. You must always avoid the use of slang, nonverbal cues, and use more direct statements. Provide feedback about appropriate responses. Enhance verbal communications with illustrations. Use pictures to communicate with those who are nonverbal. Provide time for social interactions. Use a student's fellow peers for support. And it's always important to initiate communication and taking turns with communicating with these students. There are several different support programs and services available for students with autism, both in and outside of the classroom. Those include applied behavior analysis, TEAACH, or TEACH with an extra A, Young Autism Program, Pivotal Response Therapy, Occupational and Physical Therapy, Relationship Development Intervention, and Social Communication, Emotional Regulation, and Transactional Supports. In conclusion, autism is a growing disorder affecting more and more children each year, and it's critical we continue to increase the amount of autism awareness. Autism is a spectrum disorder, and therefore there is no single specific cause for it. The severity of autism varies from person to person. While there are no cures for autism, there are many tactics, support systems, and services available that can benefit students with autism. All of the services, supports, and techniques offered to students with autism can help them become independent citizens who one day would be able to further their education and maintain a job.